The number of people hospitalized with the flu has doubled in recent weeks, and it's part of the reason why our local emergency rooms are so overcrowded.
People are being forced to wait for hours. They're being treated in hallways with little to no privacy because there's just not enough space. So how long is that new expansion at Strong going to take? Here's News 10 NBC investigative reporter Jennifer Lukey.
120% capacity, that's where Strong is at right now. Today, 1,145 admitted patients. It's one of the highest numbers they have ever seen here.
Steve Corona experienced the overcrowding firsthand.
We were just appalled by the waiting room. I mean, it was dystopian, really.
And things weren't much better once they got beyond the waiting room.
My brother was shoved up against a wall in a bed, and there was people running back and forth. I mean, fairly narrow hallways can just barely make it.
Even on a good day, there are not enough beds in our local emergency rooms.
We have less beds, hospital beds, per capita than anywhere else in the state.
And the combination of a surge in the flu and hospitals being unable to find enough nursing home beds for patients who need them has caused things to go from bad to worse.
People are getting care in the hallways. We're bringing the equipment, and the staff needed to take care of them, but it's not a comfortable environment for them right now.
There is major construction going on at Strong. Phase 1, an expansion of the emergency department, will be done sometime in 2026.
But the ED will be 3 times the size of the current ED. So even if we're caring for as many patients in the emergency room, they will all have a private space, they'll be able to be separated, and it will definitely be more comfortable.
It's not until phase 2 of the project, the tower, where more beds will be added, and that isn't scheduled to be complete until 2027.
And we will get somewhere between 20 and 40 more inpatient beds, and it will give us more flexibility if we did need to take private rooms and make them double in order to move patients from the emergency room to the inpatient setting.
But for now, they've got to do the best they can with the space they have.
I don't know, it's an embarrassment for our community, I think.
So for now, the advice is simple. If you think you're in a life or death situation, still come here to the emergency room or any of the emergency rooms in our community. But if you're not, start with your primary care doctor or an urgent care. Some of the very same doctors who work at the urgent cares work in the emergency rooms, and they can always raise your level of care and send you to the hospital if you truly need it. In Rochester, Jennifer Lukey, News 10 NBC.